Come join Melissa and her guests on the Chats from the Blog Cabin podcast. From North Carolina, this podcast will have you feeling like you've known these folks for years. Listen in as they chat about life, culture, current events, and more, all with a special Southern flair. Curl up with your favorite beverage and get ready to be entertained. Tune in now for a unique experience that's fun and insightful.
Welcome back to another episode of Chats from the Blog Cabin, the show where I virtually invite people into the Blog Cabin to chat about life. And today we are chatting about something that's very overlooked, and that's women's healthcare. Today, innovation is finally catching up to our lives, but not necessarily all the innovation technology that we have is what we need. So in this episode, we're going to talk about women's healthcare and how FemTech, which is the FemTech Revolution, is changing the game from cycle tracking to fertility support to menopause and overall well-being, but there's also drawbacks to that. So join me in welcoming Bethany, who wrote the book, The FemTech Revolution. Oh, I can't talk today. And Bethany, tell us a little about yourself, because I think this is a very important book that every woman needs to read, because I saw myself highlighting this book. I'm like, I'm going to pass this on to my daughters because I have 3 girls. So this is very important. So Bethany, tell us a little about yourself before we talk about your book.
Well, thank you, Melissa, so much for having me. I'm so honored to be here and to talk about women's healthcare. As you mentioned, it's such an overlooked topic, and especially in today's age and environment, it becomes more and more important to be protective of our data and make sure that we're using tools that actually support our health instead of placing us at risk. So excited to be here today to talk about it. I'm an attorney by background, and I've been practicing law, goodness, for not to age myself, but more than a decade. And as I continued in my legal career, it was interesting. I had my own women's health issue very unexpectedly. Of course, it was at the height of COVID, and I was left to navigate the patient journey experience as a patient instead of as an advocate and a lawyer. And I can tell you that fundamentally changed the way in which I saw women's health care, because at the time I had gotten diagnosed with fibroids. And I was that person, right, who goes to all of my annual physicals, and yet I had fibroids that made me the equivalent of 6 months pregnant, and they were actually crushing my internal organs. And I could not believe how this had been missed. And more shockingly, how I had dismissed my own symptoms, even though I'm a healthcare lawyer and I know better. And so that journey really changed the way in which I wanted to practice law. I transformed my practice at that point to focus solely on women's healthcare. I have the first law firm in the US that's all I do. We focus exclusively on women's healthcare and helping startup companies get the products that women need to market faster, while also prioritizing things like privacy and accuracy. As a result of that, I am the founder of Women's Health Innovation Consulting, which is the law firm aspect. And then I'm also the founder of Fem Innovation, which is focused more on uniting the femtech and women's health industry in order to support these products and gain awareness, and also provide awareness to patients that all of these products are out there and coming to market. Because, and I'm sure we'll get into it, we have a huge censorship issue when it comes to women's health care. So that is my background. I love it. I'm in North Carolina, Melissa. I know we've got a connection there, and that's where I call home right now.
Where in North Carolina?
Charlotte.
Okay, well, I'm in Goldsboro, so I'm on the other side of the state.
I went to college in UNC Chapel Hill and law school in Wake Forest, so I'm familiar with over that way as well.
Well, I want to talk to you. You hit on something talking about how you had fibroids that looked like you were 6 months pregnant. I want to bring you back to a story that I wish we had more technology available. My sister has been gone 30 years, but she also had, it wasn't fibroids, it was tumors, but it was a cyst. It was cyst in her ovaries, and it made her look like she was 6 months pregnant. And the doctors dismissed it because they said, oh, well, you have asthma and everything else. So it's just your asthma and everything else. So we're not even gonna, attempt to try to do anything. But when she finally says enough is enough, because she looked pregnant, but she wasn't pregnant, they discovered that she had tumors all up and down her right side of her body. Almost 85% of her body was covered with tumors by the time they finally diagnosed her. So I think it's important that we talk about women's health care, because a lot of women get dismissed when they go in with all these symptoms. And I like what you said in the book about having a 1-page sheet where you talk about, you're tracking on these apps, but you have this 1-page sheet that you're handing to your doctor and saying, here, this is what's going on. This is my main concern, but these are the symptoms that are coming, because doctors are more analytical and looking at, they're so used to, like you said, looking at lab results than they are actually having conversations. And they're so quick trying to get the patients out so they can service another patients because they're overworked, obviously. So, but I love that you brought that up. But if that had been around 30 years ago, when my sister was 27 when she passed away, I can't just imagine how her life would have been so different, because she would have been able to track and been able to go, hey, this is what's going on, X, Y, and Z, but they couldn't do that. So let's talk about that.
It's so tragic. And oftentimes, right, if you're a younger woman, you're dismissed even more often and more frequently because doctors have it in their minds, right, that cancer or certain other illnesses only happen past a certain age. And so getting the testing that you need becomes even harder, not just because you're a woman, but because you're a younger woman and the doctor's saying, hey, it's unlikely that you're going to have something wrong with you. And so you get dismissed more often. It is so tragic. It happened to my mom, and that was my first instance, an experience with the healthcare system. So I was maybe, 7, 8 at the time, and my mom would just collapse. She would not be able to move. She would be very weak. She couldn't even remember how to get home. She would be maybe a block from home and couldn't remember which house was hers. She would get lost just going out of the neighborhood. And she was a physical therapist at the time. And it became very difficult for her to even function. And she saw doctor after doctor, neurologist, specialist, anyone that you can imagine, for over 7 years. And nobody could figure out what was wrong. And they told her it was all in her head. And so as a child, right, I watched this constant dismissal, running all the tests and being told, you're faking this. Ultimately, whenever we did get a diagnosis, we ended up at Mayo Clinic, got a diagnosis, and we looked back at the charts and things, and some of the testing revealed this and was never, it was never even picked up by any of the doctors. And so that was my first experience with women being dismissed in the healthcare system. And as I dove into the research more and more, it happens to us so frequently that almost 75% of women feel at some point in time that their doctor has dismissed them or is not at all curious or caring about their concerns. So the one thing, that really stuck out to me about that was we need to be advocating for our own healthcare. And it's easy to sit here and say that, right? It's easy to, as a, somebody outside of whatever you're going through, to say you have to be your own advocate. And I didn't even realize it until it happened to me. And it happened to me in the context of pain management. Following my fibroid surgery, I ended up as well at Mayo Clinic. And because my fibroids were so large and crushing so many different organs, my surgery was longer than a routine heart transplant. And when I came out of that surgery, I was severely undermedicated, and I had maybe 2 to 3 days of pain medication, and that was it, from a male doctor. And I was screaming in pain. My mom was calling the doctor trying to get more pain medicine. And I remember the male resident on the phone saying, "Oh, it shouldn't hurt that." And I was just flabbergasted. And I said, "Do you have a uterus that was just cut into in 6 different places? Because if you don't, stop telling me that this shouldn't hurt, because it absolutely does." I was later informed by my regular OBGYN when I got back home that I was undermedicated by 2 weeks. And so that to me signified that no matter how familiar we are with the healthcare system, right, no matter how educated we are, dismissal happens to us on a daily basis. And if we are not equipped with the tools to fight for ourselves and what we think that we need, we're just going to get dismissed, and we're going to unfortunately not have our problems addressed until, like your sister, it's too late after that constant dismissal. And so it's so sad, but FemTech, and I can get into what that means as well, but FemTech really has given us the tools to be able to advocate for ourselves today, because it allows us to track our bodies and our symptoms in ways that we didn't have before. And what I've seen more and more of and been encouraging is people to take that data that they've collected at home and show it to their doctors. And then you have kind of this proof that something isn't right. And doctors are much more likely to take that seriously than you coming in and saying, "Hey, I'm losing sleep for X amount of nights. I'm having these sweats. I'm having XYZ pain. I've missed my period, or my period is so heavy that I can't even function." Right now you have data to back that up. And doctors, especially due to malpractice concerns, are going to be a lot less likely to outright dismiss you there. So that's something I think FemTech has done a really good job of, in giving us some autonomy and agency over being able to collect information about ourselves and use that in an empowering way.
Yeah, why do you think more women are likely to be dismissed by doctors? Like you said, it was all in your head, and they told your mom that it was all in her head. Why do you think that's? Because it doesn't sound right, but that's the truth.
It is. Yeah, and I think it stems from a couple of different things. First, I think there's this perception, and it's obviously incorrect, but it has existed for centuries, right? That whenever women complain, we're being hysterical, right? We're overreacting, we're being hysterical. It's because of our hormones, and it really isn't as bad as we're saying. And so, I mean, that has existed for centuries. That's why we kind of have that term hysteria, right? When somebody couldn't figure out what was wrong with women, they say, oh, she's, hysterical. It's just hysteria. Go lock her in a mental institute. And so we've seen that throughout centuries, and that has kind of formed the basis for how women are perceived whenever they have complaints or pain or things that are wrong with them. So that's kind of the first thing. The second thing is oftentimes women are going to present with different symptoms than men. And part of the reason for that is diseases don't manifest the same way in women as in men, right? We're different. And no matter how often medicine tries to say that we're only different in our reproductive organs, we know that's not the case, right? We know women exhibit different heart attack symptoms than men. We know autoimmune diseases are going to be 2 to 3 times more likely to happen in women. And because of that, there's fundamental differences in our bodies, even with the way that we handle drugs. But the problem is that research is so far behind. So we know we have these differences. We know women are going to react differently to different illnesses and medications, but we don't have the research to show what that necessarily look like. And so whenever a woman goes to her doctor, right, what they're using to evaluate her is the male body, right? Our male body is our default standard in medicine, regardless of the fact that it doesn't suit us as women. And because of that, if you're not presenting with classic symptoms that are easily recognizable or easily tied to a diagnosis, you're more often going to be dismissed. And you're also going to be dismissed because unless you have a concierge medical service provider, you're probably limited to a 10 to 15 minute window with your doctor. And so the doctor's going to take a look at you, say, that doesn't fit anything that I'm seeing. I'm going to look, maybe I look at your age, right? And I say, hey, you're 27. It's very unlikely that you have something wrong. We're going to assume it's, asthma, right? Or whatever condition that you've already been diagnosed with. And I'm going to send you on your way. And it's kind of a combination, right? Of the male body being the default, women's symptoms presenting differently, and the fact that we have physician shortages coming up and not enough time to really dedicate to the problems and the patients to make sure that we're getting to the root problem that they have.
And also too, the disparities in healthcare, because, like right now, we just had a country shut down like last year because of healthcare. And there's a possibility of looking down now, possibility of another shutdown because of healthcare. And people don't realize how expensive, especially it seems like for women, it seems like the procedures are a lot more expensive than they are for the men as well.
They are, and it's interesting because it ties back, at least for some instances, to the relative value unit, which is how we value the monetary reimbursement for medical procedures. And it used to just be used in Medicare and Medicaid, but now it's used kind of as a basis for all insurance whenever we're thinking about how we're going to reimburse claims. And what you can see from that, for instance, is that something like a shoulder repair, that might take maybe, let's say, 30 to 60 minutes. That's going to have a higher RVU value, meaning it's going to be a lot more profitable than a surgery like endometriosis. That could take 5-6 hours. That actually has a lower reimbursement rate. And so despite the fact that it's taking longer, it's a more complex procedure, it's going to be substantially changing someone's life, that is less profitable than going in and doing a shoulder repair. And because of that, what you see oftentimes are hospitals and other healthcare institutions prioritizing the higher paying surgeries because healthcare at its core is a business. And sometimes we forget that, right? We think it's an altruistic model where the industry is supposed to help us get better. It is, but only in ways that make it profitable in most of the instances. And so because of that, a lot of the gynecological procedures that are out there are less reimbursed than even other procedures that might occur on, male reproductive anatomy. Those might be valued at a higher RVU. And as a result, we have longer times that we're waiting for our necessary procedures, like an endometriosis excision. We get delays because those aren't as profitable. So we get less OR time and less resources dedicated to those types of procedures. And it's very sad and very unfortunate that that's the basis of the entire healthcare reimbursement system.
And that is so sad. We need to take a brief commercial, but then we'll be right back.
The threats women face today are unparalleled and even more dangerous than ever before. 1 in 3 women globally has been the victim of an assault. Women are terrified and they are looking for answers.
In the book, Street Smart Safety for Women, we draw on our experiences, both personal and professional, to provide those answers. It's by women, for women. Street Smart Safety for Women is available wherever books are sold.
In a world full of chaos, she chose to anchor her story in hope. Through storms and silence, she found strength. And now, she's inviting you to do the same. This isn't just a book, it's a lifeline. For every woman who's ever felt unseen, your healing begins here. Anchored in Hope, available now.
And we are back with Bethany. And Bethany, we were talking about the difference in women's healthcare and men's healthcare. And you wrote the book, The FemTech Revolution. And so do you want to read a part of your book now?
I would be happy to. So, the FemTech Revolution, it's really a how-to guide for women for how to find technology that's going to help you take your case and present it to a doctor and stay safe and monitor your healthcare without being taken advantage of, especially in a world in which we're in this post-Roe versus Wade environment where our data can be used against us. And so I have a passage that I would love to read. It is really about FemTech's invisible currency. And what I mean by that is we're talking about the value of your health data in this system and why it's actually important that you care about it. Because a lot of times we can say, hey, I'm getting this, product for free. It's okay if you want to use my data. I'm getting this for free. I'm getting a benefit. And so I'm going to give you my data. What we oftentimes don't realize is how that data can be used downstream to then harm us. And in this chapter of the book, I specifically share an example, and this is for anybody who has the book, it's chapter 5. I share an example about a woman named Rachel. Of course, that's not her real name. I've changed names, but how she had used an app and continued to put in her data and then saw her healthcare insurance premiums increase. And they increased pretty substantially. And she was very concerned about that and didn't realize that her data, combined with millions of other women using these apps data, can be purchased by health insurers, and that data can then be used to raise premiums across the board. And so I have a section here where I say, most of us don't think twice about handing over our health data to an app, especially a free one. After all, it's just information, right? A few details about your period, fertility tracking, pregnancy symptoms, or even sexual health might not seem like a big deal. Like Rachel, we may even think about our data in terms of secrets, as if privacy only matters if we have something to hide. But what if I told you that your health data is one of the most valuable commodities you own? Health data isn't just numbers and charts. It's a highly lucrative asset that companies, insurers, advertisers, researchers, and even political organizations are willing to pay top dollar for. It can predict your future health risks, shape your access to care, influence the ads you see, affect insurance rates, and impact financial opportunities. Yet many people tend to think of data as valueless, just numbers, information, and facts about our bodies. We trade it freely for the convenience of new technologies that promise deeper health insights or greater control over our well-being. But unlike a credit card number, which can be canceled or changed, health data is permanent. Once it's out there, you can't take it back, and that's what makes it so powerful. The true value of health data lies in what it reveals. A single medical record is far more than an ID number or transaction history. It's an intimate blueprint of your body, behaviors, long-term health patterns, and financial history. It contains everything from diagnoses and prescriptions to insurance details, billing histories, and even genetic data. This makes it one of the most sought-after commodities. There was a 2021 report that estimated that a single healthcare record is worth up to $250 on the black market, compared to just $5.40 for a credit card number. In other words, your health data is nearly 50 times more valuable than your financial data. So that, to me, is kind of the foundation for the FemTech Revolution, because we talk about the fact that there are so many fantastic technologies out there and new ones that are coming to market, but there's absolutely no guide out there until the FemTech Revolution about how we as consumers have power to protect ourselves and make sure that we're choosing the right technologies while staying safe and protecting that valuable health data.
For sure. And I want to point out, if you're watching this on YouTube, the QR code up there in the corner is where you can immediately go to Amazon and grab the book if you want it, because I think it's important. And that's something that the streaming device that I use has come up with, which I think is awesome. But I want to talk about, when you were talking about the girl, I think you said her name was Rachel, but you also talked, I don't know if it was the same story, because things kind of go in, you remember things, but you don't remember the name, about how one of the girls was using the app to kind of journal and relay her feelings. And she was talking about how anxious she was and how she had some anxiety. And then all of a sudden she was diagnosed with anxiety because of the app. Not because the doctor diagnosed her, but because of the things that she'd written in the app. Can we talk about that?
Absolutely. So oftentimes whenever you use a healthcare app, there's going to be an option to sync your data with the data that your healthcare provider might have. Now, this isn't available on every app, of course, but the more and more integrated that healthcare gets and the more technologically savvy the healthcare institutions get, the more data they want, right? Because there's a perception as well, right? That the more we know about a patient, the better we can serve that patient and make sure that we're looking at them holistically. And so sometimes whenever you sign up for a healthcare app, what you'll see is the opportunity to integrate it with your healthcare provider or into their EMR system, electronic medical record system. And sometimes we just think, yeah, okay, what is the harm in doing that? And so sometimes we just put in our provider name, right, and their information, and that's that. What we might not know is that for apps that might be, for instance, mental health apps, right, or journaling apps or things like that, the data that we were putting into that app can potentially then be sent to our healthcare provider because we've given permission to share that information. When that happens, that information that you were putting into a seemingly harmless app can become part of your official medical record. That can be a medical record, right? That healthcare organizations, et cetera, are looking at whenever they're determining the claims and how much that you're going to get charged for insurance and all of that, pre-existing conditions, et cetera. So what happened in this case was we had an individual who was using a journaling mental health app. She had put in for the information to be able to go to her provider. She then had a different kind of unrelated health issue, went and sought specialty care. And whenever she came in, they had all of that information that she had journaled, all about her anxiety, her stress, all of that, and gave her, essentially she had a diagnosis of anxiety without ever really having done that with a physician and told any of that information to her physician. And because of that, right, that is now all in her medical record. That's accessible information for pre-existing claims, everything like that, all because she simply used a mental health journaling app. And so we need to be careful whenever we sign up for these apps that we understand exactly how our data is being shared, because if that's something that we don't want our healthcare provider to see, we want it to be personal to just us, then we need to understand the settings and the permissions that we're agreeing to whenever we sign up for these applications. And oftentimes, and it's nobody's fault, oftentimes we are not reading the fine print because who has time for that, right? I mean, there have been studies that show how many years of your life it would take off if you read the privacy policies and terms and conditions of every app and website you used. I mean, it is insane. I'm a lawyer. I do not read all of the fine print for every single thing that I use because it is impractical. And so we need tools that are going to show us, how can we find that information fast? How can we skim it? How can we know exactly what we're signing up for before we go ahead and click that I accept without just blindly putting information in there and not knowing where our data ends up?
Yeah, and you also pointed out there are key words, key terms to look for in that may jump out at you. If you don't want to read the whole thing, then look for those key words. So can we talk about those keywords?
Absolutely. So one of the things that I have set up in the FemTech Revolution to help you be able to vet these products that are out there, and it's for FemTech, but of course you can use it for any kind of health technology, regardless of whether it's women's health oriented. I've created what's called the SAFE method, and it's designed to be completed in 15 minutes or less. And so it stands for security, accuracy, foundation, and equity. And so those are the 4 key pillars that you want to analyze any type of healthcare product on. And so this really kind of comes in for security, which is related to privacy. There is absolutely no way that you're going to have time, as I mentioned before, right, to read all of the fine print. And you don't need to. What you need is to find out how a company is using your data and how they're disclosing it downstream. That's the real key here that we want to make sure that you understand and are comfortable with. And so before I even talk about kind of key terms, what I first recommend for everyone to do is to sit down and think about how you're okay with your data being used, right? The data that you're going to put into an app. Sometimes it might be healthcare data. Sometimes it might be more sensitive data like reproductive healthcare information. And so I would think about those kind of 2 categories, kind of regular healthcare data and then the more sensitive information, and think about how you're okay with that being used. Would you be okay if it's used to help improve the product? Okay, most of the time that's going to be a required and an acceptable use. Are you okay with it being used for research and development purposes, maybe for, healthcare research downstream that can actually help millions of people in the future? Most people are typically okay with that. Are you okay with it being sold to data brokers who could then potentially sell it to health insurers or law enforcement officers? Most of the time, this should be a no for you, because if our data is being sold, once it is outside of that health app, we have no control over it, right? It's kind of like once the cat's out of the bag, you're never going to get it back in. You have no control. So if there's language in a privacy policy that allows a company to sell your data downstream, you should be very wary of that application, because you are losing a lot of control over how your data can be used and sold and then resold as well. Think about those different instances. And of course, in the book, I set out a kind of listing of categories that you should go through. And then what you should do is, for any app that you're either currently using or thinking about using, pull up the privacy policy, and you don't have to read it all, but search for things like data use, right? Data disclosure. Look for the word sell, right? Or sale to see if they're selling your data. Look at how this is going to be used for things like law enforcement, right? So you can search law enforcement to see if they're specifically calling that out. That's really what you want to understand. You want to understand what they're collecting and how they're using it. Now, you're most often in this privacy policy is going to see that they're using your data, right, to improve their product. Some may use it for downstream research. They're probably going to be given, have language in there about being able to give your data over to like their business partners, like things like lawyers, right, or accountants, especially if it's a paid model. All of that for kind of their internal functioning. Fortunately, you're probably not going to be able to do much about that, because you're going to have to accept that in order to be able to use the product for almost all the products that are out there. But if something says, we're going to sell your data, we can disclose your data downstream without your consent, anything like that should be a huge red flag to you. It should also be a red flag if they're either not specifying what they would do if law enforcement comes knocking and asking for data. A lot of privacy conscious companies, especially in the FemTech space right now, are explaining how they handle those types of subpoena requests and other requests from law enforcement when it comes to reproductive health data. So you want to understand how they're going to handle that. Are they simply handing everything over? Or are they saying, hey, we use such great security measures here that we cannot physically hand over your data because it exists outside of our control? Are they saying, hey, we'll only respond to valid subpoenas? Are they saying, we're going to challenge and not give over data upon request? What does that landscape look like? You want to know if there's any information in there that talks about that. And then you want to assess, did that align with the privacy preferences that you had already written down, saying, okay, I'm comfortable with this, but I'm not comfortable with that. And that process can be very fast and can be very quickly done once you know what your preferences are and just control finding those types of keywords in the privacy policy.
Yeah, because I know there's like one of my friends will not download any app that will track her anywhere. I mean, literally, I think the only thing she has is the Find My Friends app so she can track her son. I mean, but that's pretty much the only app that she'll have because she does not want her information out there. She doesn't want anybody tracking her. And that's what we got to realize, that even with the iPhones, there's tracking if you have a Google device, and I could say it, but she'll go off right now, in your house, she can track you. The spur of the moment.
Oh, absolutely. And it's interesting too, because we have this perception well, we have a couple misperceptions, but there's usually this perception that law enforcement can only get my data through a subpoena, right? They've got to kind of come for my data. That's actually not the case. And a lot of people don't realize that. That same data that they could get by getting a subpoena, if the app allows for selling to data brokers, law enforcement can go and purchase that data legally, just like you can, just like I can, and get access to that same data without going through those legal hurdles. And so, there have actually been instances where data brokers have sold information to other types of individuals, sometimes reporters even, who are researching stories. And one of them showed that you could actually see where a person came from when they went to a reproductive health clinic and where they went afterwards. And you could use that to actually identify the person. That's the kind of data that is out there. And given how much we can't control, we can control which apps we will allow to have our data and use our data. We have that power. And we as consumers actually have the power to force a lot of these healthcare companies to change how they use our data. We just don't realize it yet. And we haven't banded together yet to make that happen. If we start making privacy conscious choices with which companies we're going to use, we then give them a market incentive to enhance their privacy and protect our data. So why aren't we doing it? That's the big question.
Yeah, why aren't we doing it? That's something, because I've just recently seen where, with everything going on in this country, now that they're going to start using ancestry, the DNA to try to find people that are here in the country illegally, to track them that way. And if you allowed them, if you gave them permission to do that, then they can track you. And you've also watch SVU all the time, and I see where they can get a suspect because they see that they have a DNA similar to, they find a relative of that suspect, and then they're able to go down the line, putting, even if it's not just you, it's your family members, that they can find you through your family members as well.
Absolutely. And it's scary whenever you think about all the possible uses that can exist for our data out there and how it can be used against us. And we both asked the question, why aren't we thinking about being more protective of our privacy? Why aren't we demanding that change? I think part of it comes from the fact that women's healthcare has been so neglected over the centuries that the fact that we now have tools designed for our bodies and to help us track is so exciting that we're just take our data, right? Take it. We are finally having tools that we can use. We finally feel empowered, and we kind of forget about the ways in which this could be used against us. And so that's kind of, as we're moving forward in women's healthcare, yes, it's great to have these tools, but because we're getting more and more companies into this field now, we typically will have choices. And we need to be making sure that we're making the right ones because, as you said, Melissa, right, we're not just hurting ourselves and our own data if we're being, careless with who we're giving it to. We're increasing insurance rates and premiums across the board for women, right? We're potentially allowing law enforcement to track illegal reproductive health activity in certain states. That all matters and is trackable. And it's all things that we need to be conscious of, but we don't need to be fearful. And that's the other thing I want to make sure that I'm clear on. Yes, this is a scary environment, especially post Roe versus Wade. But the answer is not to just boycott all apps, right? Or all FemTech apps. Because if we do, what we signal is that women's health is not important, that consumers are not going to use these apps, and we don't need more innovation in women's healthcare. And that is the farthest thing from the truth. Because, really, women's healthcare gets so little funding as it is that we can't to simply say we're not interested in solutions. And that's what happens if we take a fearful approach. We signal to the market that this is not something we're going to buy and that women's healthcare is fine as it is, which is absolutely not true. So that's why we need to be informed and empowered to make the right choices that protect us so that we're not placing ourselves at risk, but that we're still signaling that we want innovation in this field.
Yes, and along with that, there's a lot of disparaging within the women's health apps for women of different colors, for not tracking, like you mentioned one time, there was one girl, she had a complete hysterectomy and she was tracking her period. And they were like, oh, you're 10 days late. Congratulations. A little stork pops up and she had just had a hysterectomy. So, there's that disparaging too. And I like the fact you pointed out that a lot of people that are making these apps, that are coming up with these apps, are men, and they don't have female input into these apps.
Yes, and that's why equity and foundation are so important in the SAFE method, because that's what we're looking for, right? Not only is it about our privacy, right, and our health data and what's happening there, it's also making sure that we support solutions that are going to be inclusive of the entire female population here. Because if we don't, what happens is exactly that, right? We get apps that make certain assumptions about women. For instance, one of the very big companies out there for fertility tracking, and I won't name names, but I'm sure it's called out in the book. One of their earlier models assumed that anybody who was using a fertility tracker was trying to get pregnant. That was the full assumption, right? Full stop. And it excluded so many people. But what it would do is whenever it came up that you might be in your ovulation phase or whatever, it would then send a message to your romantic partner saying, that they should bring you flowers. It would tell you to wear nice underwear. And it made all of these assumptions that were so offensive to women that it lost some of its market share whenever that happened. And part of that comes from the foundation of the company, right? Is this a product that's being built by men who have absolutely no experience with this? And that's not to say that all male founders, right, are in femtech are bad. It's to say, what is their interest? What is their experience? Why are they passionate about this? Are they somebody who's hip hopping from different industry to try to make money? Because if so, that's someone who's going to be more likely to sell our data and not really be invested in long-term improvement in women's health. Maybe this is somebody whose wife had this issue, right? And so they're deeply connected, or their daughter did, and they're deeply passionate about this. That's going to make for a much stronger foundation than somebody who's just trying to make money. It's also why you see in femtech such a higher percentage of female founders than any other industry, because oftentimes the women who are experiencing the problems and have no solutions are saying, screw it, I'm going to create a solution so that whoever comes after me has a resource that they can use. And so that's part of the reason that we also have a higher percentage of female founders. Now, of course, female founders typically get less funding than men, right? So that's also kind of contributing to the problems that we have in femtech from a funding perspective. But right, the point is that foundation is crucial because it's going to also impact equity. And what we've seen in some of these products, and not just femtech, but also healthcare in general, is that sometimes they're just tested on a small population, right? Maybe it's all Caucasian women. And when they do that, maybe they don't realize that this monitoring device doesn't react the same to darker skin tones. And so it's less accurate for those women. Or now that we're, of course, in the age of AI, maybe our algorithms are trained on data that's not representative. And this is happening a lot. And so if it's not representative data of the entire, population and the different races and ethnicities out there, what happens is the results are less accurate for certain portions of the population. And that's one of the huge issues we have in healthcare right now is the gender data gap. Because of course, women were excluded from clinical trials for many years. And so we don't have as much information and data on women's bodies. And because of that, we're actively trying to fill that gap. But it necessarily might mean that some algorithms and apps are going to be less accurate and less inclusive than others, depending on how they're built and how they're trained.
So how do we find the right app for us? Because I know with the funding now, funding's been cut because I have a daughter who's studying the effects of air pollution for her PhD on pregnant women. And she's studying that right now, but the funding has been cut because she can't put that she's a woman. She can't put that she is a minority woman because she's Mexican American. She can't put any of this in her fundings. The studies that she has to do, she can't put down what particular age group, what particular gap, anything like that down. So how do we find the right technology for us as women to use that is going to pertain to us and not somebody else, not a Caucasian woman, maybe an African American woman, a Native American woman, a Mexican, a Latina, all this, how can we find those?
Absolutely. And this is really where the SAFE method comes in because, right, we've talked about privacy, but now we're getting into those last three aspects, right? Accuracy, foundation, and equity. Accuracy is really important because if we don't have accurate products, what is the point? Yes, it's great that we can track different metrics, but if we're not getting accurate insights and predictions for our body, it's pointless. And so the first thing I say with respect to accuracy is take a look at the website and the application itself and see what scientific literature it is citing. Has it undergone any type of clinical studies? Has it had trials? How are they showing accuracy? Oftentimes, the applications that have not undergone accuracy testing, they're going to be pretty silent on this topic. The other thing to look at too, right, is to, if you can and have a little bit of time, just make sure that the studies that they're citing, if there are studies cited, are relevant to what is actually the product, right? Because sometimes they'll say, yes, there's this study that shows that this sensor, right, is 95% accurate for African American women. Okay, but maybe that sensor is 1/200th of this product. Does that mean that the whole product itself is actually going to be 90+% accurate for that racial group? No, it doesn't. And so you got to make sure, because some companies get a little tricky and a little sneaky there, right? That these studies are actually for the overall product itself. So take a quick look at their, if they have blogs. Oftentimes the companies that do this, right? They do the clinical trials, they do the accuracy studies. They're going to be so upfront about this because they're going to be proud of that data and they're trying to help women. So it should be something you can easily find on the website. It might say, scientific background, right? Scientific basis, that type of thing. It might be on a blog or a news site. Take a quick look there. If there's nothing, just kind of search it in the news as well and Google real quick the product name or the company name and accuracy or scientific study or research and see if there's anything that pops up there. If nothing is popping up, it probably means it hasn't been tested, and that can potentially lead to accuracy concerns. Also see if there's any, sometimes doctors will endorse or, kind of people who have used this and would recommend it to their patients. See if there's those types of endorsements from doctors that are reputable. Then we get into the kind of foundation, right? And that's making sure that we are having products that are built for us by people who are not trying to take advantage of us. So while you're on that same website, look at the About section, look at the founder, look at their team. If you see a team that is all Caucasian men, probably not going to be a very representative product, unfortunately. And, you can also look at kind of like their board members, if they have a board or their advisory board as well. But really looking at that core team to make sure that there's some diversity there is going to be absolutely essential. If I pull up a product page and it's all white men, that's not something I'm probably going to invest my money and my time into because I know that they may not have a diverse representative voice in those product development meetings. So that to me is a red flag. And then go ahead.
No, you are bringing about the board. You also said that if they put the board members up there, if they're on the list on the website, check and see if they've done any studies or have gone anything else, talked about anything about women's health, because that easily tells you they're here just taking up space or they're actually invested in that.
Absolutely. One time, and it wasn't a FemTech company, it was a different company, but one time a company I worked for said, yeah, Erin Brockovich is on our board. I mean, everybody knows that name. And yet when you go and look at it, she's never mentioned this company, right? She's never done anything in this field. She's, much more of just kind of a person who said, yes, I'll be on your board and didn't do anything. So be a little bit cautious when you see, advisory board members and check it out, right? Click on them. Search around on the internet, search around on social media, see if they've actually mentioned this company or their involvement in it or have some ties to that industry. And because otherwise their expertise isn't going to be necessarily valuable in a way that's going to enhance women's healthcare. And then kind of finally, right on the equity piece, look for things in the app. Like, for instance, does it support multiple languages? Is this something that will allow us to change our data inputs? For instance, Fitbit was one of the ones when they first came out with a period tracking app that would not let you put in a period more than 10 days. And so, right, you exclude every woman in the population who has a period longer than 10 days, right? So make sure that the inputs there are going to be reflective of the different experiences, right? See if there's any type of, different languages I mentioned, right? Things like that would show enhanced, equity and inclusivity for the different populations out there.
Yes. Oh my gosh. We could talk so much longer on this subject because I want to invite you back to come back and talk about this because this is something that I think is very important and we all need to be aware of, but our time is up now. And so is there one last thing that either you want to reiterate, something that you talked about before, or maybe something we didn't touch on yet that you would like? The floor is yours.
Oh, well, thank you, Melissa, for having me. I'd love to come back. This is obviously a topic that I'm passionate about. We started off by talking about dismissal in the healthcare setting. And so I think I'll end with a little bit of an empowering message on that and how we can best present our case to our doctor, right? Because at some point in time, we may need to go to a doctor and we may end up being dismissed. So what do we do if that happens? Well, the first thing I would say is make sure that you have prepared just a one page, even a paragraph, right? But no longer than one page before you go into your doctor's office, listing of what you're experiencing, right? What is your main concern? What do you want to happen from this visit? For instance, you want blood tests, right? You want a CAT scan. What do you think that outcome should be? And then your symptoms and your supporting data. Because oftentimes what happens is we get into those meetings and we get a little flustered, right? We're talking to a doctor, we can kind of assume a more submissive posture and say, hey, you know what, they know what they're doing, I'm just overreacting. Having that piece of paper whenever you go in and you say, here, this is my concern, that makes sure that you don't, just kind of back down and that you convey the seriousness of it. If you do that and you are still dismissed, fight back, right? And what I mean by that is say, maybe you're dismissed because the doctor says, hey, your labs are all in the normal range. Say something like, you know what, I know they might be in the normal range, but I'm still having symptoms that show something is off with my body. Before you chalk this up to stress, right, or dismiss it outright, I was wondering if we could do some further testing, right? Make sure that you've got kind of that one sentence when you go in that if you come away and they don't give you what you want, right, what you asked for on that sheet, how you're going to push back. Have that ready. Have it just even on an index card or on your phone. Flip it up and say that. If the doctor still says no, this is the part where you have to advocate for yourself. And what I mean by that is simply say something like, can you please either refer me to a specialist who will take this case more seriously, or can you please document in my medical record that I requested additional testing and you refuse? What that does is that creates a paper trail that your doctor refused you testing. And if something comes back later showing you had an issue, it can create a liability concern for them. That is a huge risk for them. Mm-hmm. And so that's going to make your physician pause and say, you know what, fine, I disagree with you, but I'm going to run this test. I'll order this test, because they want to be cautious and cover their license. And that can give you a way to push back in a way that's not necessarily confrontational, right? But saying, you know what, if you're going to dismiss me, that's fine, but please document that you did that.
And I love that, because that's a way of women gaining their power back and making their power. And, I just love this whole topic. I think women's healthcare is not talked about enough. Everything that's going on in this country right now. I'm just like, I just can't believe that women are lower than low right now.
Yeah. Oh, hugely, right? And even with all of these FemTech products coming on the market, you probably haven't even heard the term. You probably don't know that they're out there because of how much censorship we have in women's healthcare. So we have to keep talking about it to actually show that the products even exist.
Yeah, for sure. Now, like I said, Drew, I want you to come back on, because we just hit like the little tip. I mean, there's so much more in this book, so much more. I mean, I didn't get into the highlighted portions because we just started talking. So where can people find you, and where can they find the book?
Yes. So I am available. You can find me at femtechlawyer.com. That's kind of got all of my information out there. And it has information about the book. We're also starting kind of a women's health series called Health for Her. So keep an eye out for those things if they interest you. Also on LinkedIn. So you can find me LinkedIn/Bethany Corbin, very active there. And then on social media, on Instagram, you can find me at FemTech Lawyer as well.
And I will say that this is one book that I think every woman should read, because it really opened my eyes. Because when you download an app, you don't think about your data being out there. You don't think about it. You just think, oh, it's so convenient. I can track my periods, or I can track what I'm eating, or I can track, how I'm feeling today. But in effect, you're really sending your information out to everybody.
And you don't even know it. It's such an innocent thing to think, I'm not ashamed of health data that I'm putting in there, or things like that, or I'm just so happy to finally have a tool that I can use that you just don't think about it.
For sure. So thank you so much, Bethany, for coming on, for writing the book, for opening my eyes. I mean, I knew about tracking, but I didn't realize how much tracking. I was like, I am not doing any journaling app whatsoever now. Because that has got me really like, okay, all right. I mean, I write for a living, but I can't imagine in an app being able to sell my data as opposed to something that I own myself. It's different.
It really is. As women, we unfortunately have to be more cautious in this world than we did several years ago. And so it's important to at least understand how we can take action and be agents of change going forward as well.
Yeah. So thank you so much for coming on, guys. I will put in the show notes where you can find Bethany, as well as where you can find the book. And hopefully she'll come back on pretty soon. And until next time, if you have an app, check the privacy policy on the apps. That's all I'm going to say. Ask men and women both that are listening, check the privacy policy, because you never know where your data's going. So thank you so much, Bethany, for coming on.
Thank you for having me.
All right, until next time, guys. Bye.
Well, friends, that's it for today's chat here in the Blog Cabin. I hope something we shared sparked a thought, warmed your heart, or gave you a little encouragement for your journey. If you enjoyed today's episode, do me a favor, make sure you're subscribed so you never miss a new conversation. And if you'd like to spread a little love, leave a review or share this episode with someone who needs it. Remember, this little cabin isn't just mine, it's ours. It's a space where we show up, share stories, and shine a little light together. Until next time, keep living with hope, keep anchoring yourself in love, and never forget, you've got a seat saved here in the Blog Cabin. Take care, friends, and I'll see you in the next episode.